Good afternoon, dear colleagues and friends. I'm talking to you from afar, since as one of the dinosaurs of the ESPN, I was asked to tell you something about myself and the early years of the ESPN. First, of course, I will tell you who I am. My name is Alfred Drukker and I was born in Holland in 1932. My early childhood years were normal, but life changed dramatically after Nazi Germany had occupied the Netherlands in World War II. My parents, my younger sister and myself were sent to concentration camps in Holland, that was Westerbork, and in what was Czechoslovakia at the time, Theresienstadt. Miraculously, and I repeat that several times, miraculously we all survived. The rest of my family perished in Poland. The fact that I was a Holocaust survivor has influenced my entire life, even now. Some years ago I published my wartime Shoah story in a book called Memories Revisited, Recollection of a Wartime Boyhood. I started my medical studies in Amsterdam, but completed them in Israel, in Jerusalem, where I still live with my wife, Ilana. I trained in pediatrics and afterwards spent a year in adult nephrology, but specialized in pediatric nephrology during 2 years in New York with the late Henry Barnett, the father of pediatric nephrology, which very few still remember, and his student, the late Chester M. Edelman Jr., and his co-workers, of course. We had 4 young children when we lived in New York. In 1974, I presented my PhD thesis on the renin-angiotensin system in New York, newborn dogs. It was based on my research in New York, but presented at the University of Utrecht, Holland, in the presence of my family, the late Harmon Tiddens, one of the initiators of the ESPN here in Glasgow, and the late Chet Edelman, who traveled from New York to Utrecht for the occasion. After my return to Jerusalem, I slowly developed a pediatric nephrology division at the Shaare Zedek Medical Center. The first unit with dialysis for the very young in Israel. It involved many years of hard work treating Jewish and Arab patients. The large majority of the children were Muslim or Christian, often lacking financial backing, but of course receiving the same treatment as the sick Jewish Israeli children. I repeat, exactly the same treatment. In the course of the years, I published some 130 articles and spent some long and some short sabbaticals with and without the family in Lausanne, Switzerland, Utrecht, the Netherlands, Kansas City, Midway, USA, London, UK, Berlin, Germany, Warsaw, Poland, and finally at Sick Kids in Toronto, Canada. In 1992, I had the honor to be president of the 3-yearly IPNA and ESPN meeting in Jerusalem. I also received an honorary membership of ESPN. After my retirement, I worked for 6 years with Jean-Pierre Guignard in Lausanne, Switzerland, and after that I worked as unpaid counselor at the Barzilai Hospital in Ashkelon, here in Israel, also for 6 years. And now a bit about the early ESPN. My dear friend and colleague Jochen Erich, can tell you much more and will certainly add very many details. My first ESPN meeting was in Paris in 1971, 5 years after the ESPN had been established here in Glasgow. I remember that the lectures at the time were at the Nectaire Enfants Malades Hospital and were organized by Pierre Royer. I was invited to visit the late René Habib, a friend and at the time the world's best pediatric renal pathologist. She lived in a magnificent apartment which she shared with her husband Elio, a stone's throw from the Arc de Triomphe. I also remember the ESPN in Helsinki, Finland, run by Nilo Halman, another pediatric nephrologist who was also one of the founders of ESPN in Glasgow. I was fortunate to be invited to his home during the half-day break between lectures, where we had a great meal, played volleyball, and went naked. Yes, male and females all naked into the sauna on the shore of a large lake in which we afterwards went swimming to cool off. We all became members of the Order of the Knights of the Sauna. I still have that diploma. I also remember the wonderful 1979 ESPN in June in Cape Capri, organized by our friend Natale De Santo from Naples, Italy. Unfortunately, I could not attend all ESPN meetings because I often had no senior colleague to look after my division while I was away. But all old-timers will remember how Professor Maya Ignatova from Moscow would be dancing at the gala dinners at the end of the conferences. I tell you, that was quite impressive. Others will also remember that at the ESPN meeting in Jerusalem in 1992, I made my entrance to the feast outside town, riding a camel. Yes, riding a camel. I am very pleased and honored to be here today together with the oldest pediatric nephrologist and the youngest newborns. In conclusion, medicine, pediatric, genetics, nephrology, and most other specialties have greatly changed over the years with improved recognition and treatment. However, I have a feeling and some doubts that the patient-doctor relationship has not always improved at the same rate. I myself and my local colleagues have tried very much to bridge that gap. I have contributed more than I share with hard work and minimal financial recognition. Now, at age 85, yes, 85 I am, I still visit my old unit, which has been totally renovated under my successor and friend Jakob Frischberg, who unfortunately could not be here in Glasgow this year. I hardly can follow their presentations, but I greatly appreciate the warm personal relationships with the entire staff. Since we are in Glasgow and I got to the end of my talk, I will imitate our dear Gavin Arneil, who used to speak to us always, and I repeat, always, by quoting a Scottish poet. Not just a few lines, but even very long quotes which we hardly understood. Here I go, and because Scottish is Greek to me, and I am not familiar with its pronunciation, for some reason I will quote from Robert Burns, also known as Rabbi Burns, a very well-known poet, at least in Scotland. And here I go, in English. The best laid schemes of mice and men oft go awry, and leave us nothing but grief and pain for promised joy. A lesson for all of us working with men, and still also sometimes with knives. Dear friends, that was it. Shalom from Jerusalem, and goodbye.